People have been taking it, but again, question is the same. Sir, stress. Again, I come back to stress. Do you think every individual who is having the stress will have the same phenotype? No. Now again, there is a huge thing in that. Why few people only show the psychiatric or a psychological features of stress? Why few people only show the physical aspects of stress? Why few people don't show anything? वो कोई फर्क नहीं पड़ता. There are
very few.
Sir, very few also is a good number. Like we are talking about billions of people. So there are good number of people. They show nothing. No, चला देगा YouTube पर उसको. Okay. So, but this is true. And how? Why this is happening? And here again are two things. One is your eugenics, one is your euthenics. So some genes also coming in. There is something called a SERT gene, S-E-R-T gene. So SERT L, SERT S. Which gene you are inheriting or you have will also define your response to stress. Now the genetic. So SERT L if you have, so the stressful event for other is nothing for you. You are okay, comfortable. Market down हो गई, you're fine यार, no problem. फिर खेलेंगे. Typical होते हैं ना वो. अरे यार सब कुछ लुट गया, अरे कोई नहीं फिर खेलेंगे भाई, क्या फर्क पड़ता है, अगला दाव लगाएंगे, जीत जाएंगे. And people who are having SERT S gene inherited, they are the one. छोटी सी बात, अरे बहुत बारिश हो रही है यार, क्या होगा यार, देश खत्म है यार, आज तो बारिश हो गई यार. अरे तुम लोग यहाँ क्या पानी पी रहे हो, सियाचिन पे लोग लड़ रहे हैं यार, क्या कर रहे हो यार तुम लोग, ये बिस्लरी पी रहे हो, ये पानी वहाँ पहुँचा दो. ऐसे लोग हैं, वो हर चीज़ पे प्रॉब्लम है उनको. So this is the genetic part. Then second comes is the childhood abuse, which we always forget. Now childhood abuse can make somebody vulnerable to depression in adulthood, or vulnerable to stress response in adulthood. So childhood में हुआ, whatever sexual abuse हुआ, physical abuse हुआ, psychological abuse हुआ, family separation हुए, whatever they had. Okay, that time they did not show anything, but the circuits in the brain have been altered. Now when they become adult, they come in the real life, means independent life, the small things which are actually not stressful for the other person is making them stressed, and they are landing up in depression. So what I am trying to tell, that our variation, our heart rate variation, our heart pulse variation, the catecholamine response will be happening short term, long term, but how we are finally going to respond to it in terms of the metabolic and the mood disorders has got some linkage with our eugenics and euthenics also. How we have been, and even now it is going to be much more further, because abhi we are overprotective also for the next generation. They were also protective, our parents were protective, their ancestors were protective, but with every generation passing by, पहले 10 बच्चे होते थे, अब किस का प्रोटेक्शन करेंगे, राइट? अभी एक ही है, पूरा दिमाग उसी के ऊपर है कि इसको कुछ ना हो जाए, राइट? सो they are not being given the acute stressors of life initially. So resilience is not there in them. That will be a problem later on. Everything is given them on platter. अभी तो क्या है, पहले तो था हम ट्यूशन को जाते थे, सर हम क्लासेस को जाते थे, जा रही है सर, और अभी तो बाइजू आ गया हमारे घर के अंदर. पहले हमको पढ़ाना पड़ता था बच्चों को स्ट्रेस आता था, पापा मम्मी पढ़ाएंगे हमको, मतलब मम्मी पापा, अरे पापा, वो भी जरूरी था क्योंकि उनको फेस करेंगे तो सबको फेस करेंगे दुनिया में. अभी तो बाइजू में किसी को फेस ही नहीं करना हमको, गेम में हारने का डर ही नहीं है, सामने कोई है ही नहीं, वीडियो गेम है, अगला जीत जाएंगे. दैट इज नॉट हैपनिंग नाउ. Again I will go in that philosophical segment completely. So stressors are going to, now the reaction to stress is going to be a bigger challenge later on. हम तो सब resilient हो चुके हैं majority. We might be having the changes in the body, but we are resilient. But those people, the next generation and coming generations will be like so much, they are so much protective or protected right now that if they get a small stress, they have more chances. So probably psychiatry is going to be a big field in coming world, more than endocrine. Like in US, psychiatry is actually the top